We've made incredible advances in a lot of areas, and yet when it comes to cellulite, there still seems to be no good fix. Many products and procedures promise to get rid of it. Most turn up lacking. Here to talk more about cellulite and what's new when it comes to fighting it is Dr. Richard Shifu. First of all, this is something that most women, it affects women more than men. What exactly is it and why do we have it?
It does definitely affect women. About 90% of women, in fact, unfortunately, do suffer from cellulite, and almost none. You know, some studies indicate 10%, but clinically as a plastic surgeon, I've actually never seen it in a man. But the problem that occurs is that anatomically, there are differences in men and women between the fibers that exist called collagen or fibrous tissue between the skin and the underlying fascia that supports muscle. And within that area, you can imagine that that fascia runs up and down vertically to the skin, and in women it runs like a picket fence, and in men it's actually also cross-linked. So the skin is held down tight, and it's within that area that we see these fat globules. When these globules enlarge and they push up the skin, that's what creates that cottage cheese look. And because the skin is tethered by these fibrous bands, the skin around those globules is pulled in, or that's how you get the dimples. So you get these crater-like effects.
I want to get to a lot of other questions about how to get rid of it, but real quick, why do women have it and men don't? Is there something in history that explains that?
There's a combination of things. Number one, we know it's this anatomical basis that women have this picket fence-like appearance to their collagen fibers, whereas men have actually more fibers holding the skin taut and doesn't allow these fat globules to push through. And also it's related to estrogen. We know that there obviously are higher levels of estrogen, and the estrogen receptors are much more prevalent obviously in women. And there's a much higher prevalence because of the estrogen and because of these receptors, that there's actually a growth, more of a growth of these fat cells in women that causes these bulging areas than in men.
All right, so let's get to it. What worked the least? Because there's all kinds of procedures that make huge promises, and then also what actually works?
Well, you know, the things that probably work the least are these creams that people will find, you know, these aminophylline creams or these other lotions that are put on. And what may happen is you might be fooled into thinking it really did something because you're seeing actually initially some swelling in that area. And so you actually think, well, gosh, it looks better. And then after about 6 or 8 hours, when the swelling has gone away, the cellulite is there.
All right, so what can people do to get rid of it in a natural way?
So in a natural way, you know, the most important thing that we tell patients is you want to remain fit, even though obviously in fit people we can see it, but if you tend to be more overweight, we're going to see those fat globules extend out more, and cellulite's going to be more obvious. So trying to, you know, watch what you eat, dieting is important, and then just, you know, hydrating yourself, keeping well hydrated. If you're looking for something that's a permanent solution, that's really still on the horizons. As I tell my patients, when there are multiple options available for one single treatment, it usually means that nothing's completely effective. That being said, I think that one thing that we found promise with in our practice is something called Coolsculpting, which is a non-invasive cooling of the fat. And that actually seems to help to mask some of the cellulite because it non-invasively cools and kills some of the fat cells that are responsible for the bulges and tends to make those areas smoother.
And really quick, is it true that then it never comes back in that area?
You have the propensity for it, so it certainly can come back in that area if, for example, you were to put a lot of weight on. Now, the worst thing you want to do in somebody with cellulite is have liposuction because it can obviously make it much worse.
Ah, interesting. All right, great conversation. We're still waiting for that miracle, I guess. Dr.
Exactly.
Richard Shifu, thank you very much.
Pleasure. Good to see you.
All right.